Sir, with your permission, can we start the session, sir?
Sure.
Thank you, sir. Thank you, sir. Very good evening, everyone. I'm Dr. Venkatesh Karthikeyan, convener of IMA JDN Tamil Nadu. I'll be moderating the session. So I'm glad to see that young doctors from different parts of Tamil Nadu, as well as from different parts of country, have joined in today's webinar. In the past 3 years, IMA JDN and MSN has organized a series of webinars for the benefit of young doctors and medical students, and we have collaborated with reputed bodies like the Ministry of Health and Family Welfare, AIIMS Delhi, AIIMS Patna, AIIMS Kalyani, Star Health Insurance, Max Group of Hospitals, IAPSM, faculties from UK, US, and and from different parts of the country as well as from different parts of the world. And we have conducted more than 75 webinars in the past 3 years. As a continuation of that, we are currently organizing this webinar series on the scope of various branches and in various countries. For that, today we have a session on career guidance for career in Germany by Dr. Yogesh Kumar sir. So, firstly, I'd like to welcome our state president of IMA JDN Tamil Nadu and our national chairman of IMA, state president of IMA Tamil Nadu and national chairman of IMA JDN, our mentor, Dr. Abul Hassan sir, to kindly give us opening remarks.
Thank you, Venkatesh. Good evening, all. Dr. Hariharan, Chairperson IMA JDN, Indranil, Convener, National Convener, Under Secretary of IMA JDN, Dr. Karthik Prabhu, and all the office bearers of JDN Council, and also Tamil Nadu JDN. This is a very important, crucial event that is organized by JDN team. And all know that job opportunities is one of the important vertical in IMA JDN, and we have been concentrating of late very seriously in this particular vertical and started doing activities. And we have completed a program regarding the job opportunity UK, and we have done program for the job opportunities in US, cracking US MLE and so on. And today we have organized this program particularly in Germany, career opportunities in Germany by Dr. Yogesh, who has joined from Germany. And we will still we have to find out other options, other countries, other doors to open for our young doctors of India. Because, in another 10 years' time, there will be a congestion. There will be more number of young doctors in this country, and we will have to, government will find it difficult to engage all of them. So IMA has taken this huge task of engaging the future doctors of this country, give them space to establish this career in India and also overseas. So in this connection, we are in the process of making employment exchange portal, and it will be very soon inaugurated by National President. And I have designated this job to our State Secretary of Tamil Nadu, Dr. Karthik Prabhu, who has already got experience this kind of work. And he has done a portal and the kind of software. I have gone through that. It is very impressive. We are going to showcase it on Monday, coming Monday, that is 4th. I may and other office will see the portal, and then they will give suggestions. All suggestions will be taken, and then we will present to you, to all of you in the council, JDN council, and seek your opinions, and that will be launched. That will become a very flagship event, flagship scheme for IMA JDN. Definitely, it will pull in more number of people for JDN, and we will have to work very seriously on this to establish this job opportunities portal. So I think we are in the right direction, and we definitely establish our long-time goal or a long dream that kind of engaging or giving job opportunities for the young doctors of this country. So I thank Venkatesh and Nijavardhan and all other people who are involved in organizing this wonderful seminar. So once again, we saw that I saw the participants of the seminar. We have a very good time. Over to you, Karthik. Over to you.
Thank you.
We hear from our state secretary who is internally to the about the upcoming project of job opportunities portal. Over to you, Doctor.
Thank you, President Abul sir. Uh, yeah, see, it is my privilege to be here, and I really feel our President Dr. Abul Hasan sir. Hello, am I audible?
Yes, sir, you're audible, sir. Please.
Yeah, yeah. It's actually, I feel very so nice and happy that he's done so many projects. You take right from EMIM to the mental health of young doctors, a lot of things. Now the Jeevan program for the community to go on with the CPR program, and in that list, always Emerson has been so close to his heart, and he's been, to my knowledge, for the last couple of years, trying and getting himself involved in Emerson and JDN. And now that he wants to build this passionate employment project for our young doctors, I'm very happy. Hats off to Abul Hasan sir primarily. Second thing, now it is the need of the hour, because with the kind of medical colleges which is opening up, so many doctors influx. I think India is going to be the doctors' capital for the entire world, because the quality doctors what we produce and the opportunity that they have and that we need to have, because for our own country we have crossed ratios above the required international standards. So many people, if we are going to sit here, the opportunities are going to be very, very less. So now it is time where we need to explore the world, because we have a world of opportunities. And for this, very rightly, an employment exchange forum is required, which Abul Hasan said, Abul Hasan sir has told, and I myself personally have felt the need for it, and I've also been working on that. I was very happy when our dear president has told that to work on that project, and at the earliest, we will be coming it with the guidance of Abul Hasan sir. So best wishes for all of you, and all the best. Thank you, Abul sir, for the opportunity, and thank you, friends. Thank you.
Thank you so much,
Thank
sir.
you. Over to you, Dr. Venkatesh.
Thank you so much, Dr. Karthik Prabhu, sir, for the kind words. Thanks a lot, Dr. Ablasan, sir, for your constant guidance, sir. Today, 250 people have registered, but still many are yet to join. And to make sure that this content is available for all for future reference, with your permission, we will be uploading in our IMA JDN Tamil Nadu YouTube channel also, sir. Thank you so much, sir. So now,
Okay. Okay. Go ahead.
thank you, sir. Thank you, sir. Now, I would like to request our State Chairman of IMA JDN Tamil Nadu, Dr. Hariharan, sir, to please share a few words with us.
Good evening. Good evening, Abul Hasan sir, the ever dynamic person who's inspired so many people around this ADN and MSN. Karthik Prabhu sir, the hardworking secretary for Tamil Nadu, and who's been doing a lot of work with the JDN and MSN as well. Our convener, Venkatesh Karthikeyan, Nenjavardhan, and national convener for JDN Indranal, and all other office bearers here. See, I think JDN addresses the most important part of the medical career, where after you graduate, you are left to do lots of choices. Choices in your life, choices in your careers, choices that you have to take, whether to stay here or go abroad. All these things are there, and JDN is there to handhold all of you into this. And as a part of this, I think one of the less researched part is opportunities in Germany. I think we have Dr. Yogesh here. Thanks, Rishabh, for bringing in Yogesh, and we'll hear from him about what is the scope in Germany and how to go about it. Thank you for the opportunity.
Thank you so much, sir, for your kind words. Now, I'd like to invite our national convener of IMA Junior Doctors Network, Dr. Indranil Deshmukh, to kindly enlighten us about why one should join JDN and what is the procedure to join JDN.
Thank you so much, Dr. Venkatesh. Honorable State President, Dr. Abul Hassan sir, Honorable State Secretary, Dr. Karthik Prabhu sir, our Finance Secretary, Gaurav Shankar sir, Gauri Shankar sir, Honorable State Chairman of JDN, Dr. Hariharan sir, State Convener, Dr. Venkatesh, General Secretary, Dr. Nijavarthan, and all my dear friends. First of all, I want to congratulate the whole team of JDN Tamil Nadu for organizing this important event. JDN Tamil Nadu is working very actively since the inception of IMA JDN. Dr. Venkatesh and his whole team doing tremendous work in empowering the young doctors through such kind of events. Previously, they had organized research methodology, social and preventive aspects, and now this important webinar on career guidance. So regarding the IMA JDN, IMA Junior Doctors Network is the biggest forum in the country for junior doctors to collaborate, network, and to address all the issues related to young doctors. Our main objective is to highlight issues of junior doctors like long working hours, workplace challenges, job opportunities, or mental health. There are many benefits of taking JDN membership, like we provide medical credit points through our events, concessional registration fees in our conferences, 24/7 mental health helpline number for the young doctors. We are also creating, as said by Abul sir and Karthik Prabhu sir, we are creating a online job portal for our registered members. We promote activities related to research, financial management, personality development, cultural as well as sports activities. Our registered members also get a privilege to stay in all the IMA guest house across India. We have our online membership portal, and there's a nominal fee of ₹1,000, which is a one-time fee, and it is valid till 35 years of age. There is a eligibility criteria. Medical interns to young doctors till 35 years age are eligible to join the JDN to take the JDN membership. So I will request all the young doctors who are attending this event or going to watch in the YouTube to enroll yourself in JDN and become an official member of IMA JDN. So that's all from my side. Thank you so much, Venkatesh, for this opportunity. Over to you.
Thank you so much, Dr. Indranil, for sparing your time and explaining about the importance of joining JDN. Thank you so much. At this moment, I would also like to thank the man behind this event, Dr. Rishabh, for kindly coordinating this event. So I request Dr. Rishabh to please introduce the speaker.
So I'm audible?
Yes, Rishabh.
Okay, good evening, sir. Myself, Dr. Rishabh, Job Opportunities Committee, IMA JDN, Tamil Nadu. I initially thank Dr. Abul Hassan sir, Dr. Gauri Shankar sir, and Hari sir, and Venkatesh sir for giving us the opportunity to organize such an event. Let me introduce our speaker, Dr. Yogesh Kumar RJ. He is currently working as an assistant in trauma care surgery and orthopedics in Kinkenkum, Weserheg, St. Vincent's in Brekel, Germany. Welcome, Dr. Yogesh. During this presentation, I kindly request all the participants to switch off your videos in order to decrease the load on the internet bandwidth. Over to you, Dr. Yogesh.
So good evening to one and all who are present here on Sunday evening. I hope I'm audible. Am I audible? Can you please someone say yeah?
Yes, you're
Yeah.
audible.
Thank you very much for all the dignitaries who have introduced and for giving me the opportunity to interact with you all and share the experience of how and to come to Germany and what I've gone through. I would very much tell about all the honest, to be very honest, all the suggestions that I would give will be from a very honest view of what I've gone through. So I'll give a quick intro about what I did and what I have gone through. So I completed my MBBS from Sri Ramchandra University in Chennai in 2014, from a 2014 batch MBBS graduate from India. After 2014, I worked as a research officer for 6 months in Ramchandra, and then I worked as a medical officer in emergency medicine department in Ramchandra Hospital for 2 years. And in 2022 September, I came here to Germany. And after coming here to in Germany, I did C1 medicine course. C1 is so there are 6 levels of German language, out of which I've completed 5 levels. So every doctor who comes to Germany will have to do the same. So I did a 6 months course here in Germany after coming in 2022 September. And after that, I wrote my exam, which is called the Fachsprachprüfung, which I'll be explaining eventually now through with my presentation. So yeah, and I've cleared my exam last year, and I've got my license, which allows me to work in one state right now currently. To work in entire Germany, I have to take another exam, which I'll be doing it subsequently this year. And after that, I'm allowed to work in the entire Germany in any hospital which I want. For now, my license is currently limited to one state in Germany. But yeah, so and I've started doing my residency in trauma surgery and orthopedics here. Trauma surgery and orthopedics are together as one department. And please do excuse me if my English is not good in between, because to be honest, I have lost a lot of my English touch, or the language touch, because of German. Here we have to talk. It's literally like for anything, everything we have to communicate in German. I don't speak English much these days, so please do excuse my grammatical English failures or mistakes. So I'll start sharing the screen. Just a moment. So as Dr. Rishabh suggested, I would request all to switch off your videos or turn off your videos so that you can see the screen properly and there won't be any internet issues. If at all you do find there is an internet issue in between, I would get back in 2 minutes. Yeah, sometimes there is, since today morning, I found that there is, unfortunately, there is an internet fluctuation here in my city where I live. So, okay. So, yeah, PG in Germany, the path less taken, but in the last few years and upcoming years, I do find that a lot of many people who are interested to come to Germany. I hope you're able to see my slides. Can someone tell me if the slides are...
Yes.
Okay. So we'll go on next. So Germany, the city with the country with a lot of beautiful cities, and unlike tall skyscrapers in US, Germany is beautiful with very small buildings and beautiful gardens and so on. So I'll be discussing about why Germany, what are the pros and cons, and what are the courses that one can take up, and what are required, what are the exams that a doctor has to go through. Particularly, I'll be particularly concentrating about the MBBS doctors. I'm sorry for the dental doctors who are here. I don't have, it's quite different for the dental doctors here in Germany. For the doctors who are dentists, if they're planning to come to Germany, it's going to be slightly different, although the exams are going to be the same, but the path of how your career in Germany is going to be different. So I'm sorry, I won't be talking about dental professions here, if at all there are any dentists in our conference. So you can stay ahead and you can look into what are the requirements and examinations. That is going to be the same for all. And then I'll also be touching about what will be the financial requirements, right from learning the language till coming here to Germany. And I'll also be talking about what are the real life experiences, what I expected as an MBBS graduate back then, and what am I looking into right now, and so on. Yeah. Okay. So why Germany? My main reason was I'm interested into medical equipment innovation and so on. Sorry. So that was one of the main reasons why I came to Germany. And I also wanted to think about a place where residency or PG is free of cost. Yeah, obviously there will be a lot of people who would say like, yeah, lab is also free of cost. If you clear lab, we can study in UK also, US also, it's the same thing and so on. But in Germany, you would have already seen that so many of our medical equipments which we use in India in many of the hospitals, you would find the roots of the equipment company being from Germany, especially in orthopedics or laparoscopy or whichever you see. All of them are mostly from German based. Germany has been one of the pioneers in medical equipment technology and innovations, and that is one of the main reasons why I always wanted to come to Germany, because I had a interest in innovations always. And yeah, so it's technically in terms of technical medicine, it's very much advanced. The devices which they use, everything, the way they do an ABG, which I have seen, we do ABG from radial artery and so on, but they do ABG from capillaries. They take blood from earlobe, which was quite new and interesting. I was like, how is this even? Why are you even taking it from earlobe? They said that's capillaries, that's where the gases are, and that's where it's better, rather than pricking the radial artery, which is difficult to find and is very painful for the patient. So they're quite advanced in many small. That is one of the example that I could tell you. And yeah, the other thing is that I also wanted to learn in a different country. So that is an opportunity to learn in a country where it has a good healthcare system. It has its own flaws, although, but it's a good healthcare system. Um, they do a lot of research, and it's more based on evidence. So they talk in terms of what are the evidence, what are all there, and then they teach based on the research what they've done. And one can actually get into direct super specialization, and also, like, you can join, say for example, if you want to become a cardiologist or a gastroenterologist, or you want to become a robotic surgeon, so you can do your general surgery, and then you can take into a course into robotic surgery just along with it. So it doesn't mean that, like India, you will have to do 3 years of PG, and then we'll have to write NEET SS again, and then we have to go into super specialty programs. But here it's not like that. So once you start, you go on. You don't write an exam in between. So that's how it is. It's not like you will write an exam for general medicine or general surgery, and then you will write an exam for your super specialization like cardiology or neurology or gastro surgery or neurosurgery. So that's how it is here. So what are the pros and cons in Germany? So if I would first, yeah. So the pros first, compared to US, UK, and all other countries, Germany has a severe shortage of doctors. Even in the hospital where I work, there is severe shortage of doctors. There are so many, we need more doctors actually. So it's not just in my hospital. There are so many other hospitals where they have severe shortage of doctors and also nurses. Last week, recently, I also found out through one of my from the HR that a lot of Indian nurses have come to our hospital. They are doing training right now. So yeah, there are better chances to get surgical and super specialty surgical branches also when compared to, in US. I found that getting into neurosurgery, orthopedics is almost as difficult that it's not possible at all. But here it's quite easy. Uh, the main requirement is that we need to have a very sound knowledge of German language, and once you speak good German, it's quite easy to get into interviews and get the job or get the residency post. Salary is also good, yeah. In compared to, I would always compare with US and UK, because that's the most popular option. So if I have to compare with, now it's called as standards also. So if I have to compare with Germany, I would compare with US and UK. So compared to US and UK, the salary here in Germany is quite less, not more, less, because here in Germany we pay a lot of taxes. So it's a socialist country here, so we have to pay a lot of taxes for everything. So the salary which we get into the account later, I'll be discussing about what salary we get and everything. It'll be less compared to Germany, sorry, US and UK. Work-life balance is obviously good here. Work is from Monday to Fridays for PGs also. I'm talking everything in terms of PGs. So it's from Monday to Friday. Yeah, we start usually from morning 7:30. The rounds start, and our job is done by 3:34 max. It's in all the hospitals, irrespective of what is the caseload. At 4, when your work's done, the work's done. The next duty doctor, he has to take care of it. We have to just give the handover and leave. Unlike how we work a lot in India, here it's meant that when you work more than the work time. So if you work more than 4 o'clock in the evening, it means that we are inefficient. We're not able to complete the work given in the work time. So they say that it has to be completed within 4 hours, 4 o'clock, whatever it is. And Saturday, Sundays are holidays for PGs as well. So that means in a month you have 4 weekends, and so that's two Saturdays and 4 Saturdays and 4 Sundays. You have holidays, but you will have to do night duties and duties also on Saturday, Sunday. But it's going to be at least 1 or 2 Saturday and Sunday per month, not every Saturday and Sunday. So that is a good advantage. And yeah, the freedom and flexibility to choose different fields. So, say for example, one doesn't know which field they want to take. Either they want to take a medical branch or a surgical branch. Yeah, so they have such a they don't have much idea about which PG to take, and they're confused. So they have not found out during the internship which they like or which field they like. So or else they like something. Say for example, they like dermatology and they get into dermatology and find that dermatology is not for them. They can switch to a surgical branch also. So they can switch to general surgery or any other surgery within 1 year. So that kind of freedom and flexibility is there here in Germany. I don't think so it's there in US or UK. Such kind of freedom and flexibility is here in Germany. Say you want to take ophthalmology, you take ophthalmology, and then later you find that no, it's ophthalmology is not good for you, or you find difficult getting into ophthalmology, and you want to change to some other branch, you can change to some other branch. There's no particular thing. You just have to apply to hospitals and get a job for yourself. Here, residencies are considered as a job and not particularly as a residency. So it's like getting into a job. You'll have to apply to the hospitals as a job applicant. You'll get into the hospitals and you'll carry a logbook where you'll be doing the procedures and everything, and they'll be teaching also. I'll talk about all those things in the upcoming slides. Yeah, standard of living is good. Yeah, so that's the thing about socialist country where it's not like the rich lives the best life and the poor don't live the good life. No, here all have uh, some access or means to a good amount of salary to have a good standard of living. So irrespective of as a doctor comes into the class of the highest earning in the country. Second to business people, but doctors earn well in Germany and compared to other professions like IT professionals. But in India, it's different. IT professionals earn more than or triple than the doctors. We all know that. So I want to be honest and here. But here it's going to be different. It's the doctors earn more than the IT professionals. That's how it is here. Those are some of the pros. There are more pros which I would like to talk, but it goes on and without an end. So I would like to talk about the cons also right now. So the first main disadvantage is German language. It's not an easy language. We have to master the language really well, because right from history taking till discharge summary, it is going to be everything in German, including the bones, organs, and arteries. It's not going to be like, we don't say stomach, how we say in English. It's going to be different. We have to say it in German, which is going to be Bauch. You might say that I'm talking something or I'm talking something wrong. No, that's how it is. So everything will be in German. So if I'm to talk about pancreas, so if I have to tell that to a German, explaining about pancreas. So pancreas in medical German is pancreas, but instead of a C, there'll be a K. Instead of a C, there'll be a K. That's the spelling. So the spelling will also change when you learn the German language. And the language doesn't mean we don't learn only the normal language. You have to learn the medicine language also. So I'll be talking about all those things in the upcoming slides. So history taking. So I have to ask the patient, what's your name, your age, weight, all those things. What is the chief complaints, the presenting complaints, all shock rate, sample history, everything will be in German. So right from asking from what is the pain scale, whether the pain is radiating, aggravating, for relieving, whatever it is, everything has to be in German. And you need to speak a good amount of German so that the patients can understand what we are talking about. So the pronunciation, it differs a lot. So that means we'll have to master the language quite a lot. And so, yeah, including the communication between doctors and doctors and sisters will also be in German. So the amount of English that I speak in a day is hardly anything. So it's mostly 0%. So I only speak in English when I speak to some other colleagues in India, or when I do a presentation like this. That's the only time I get to speak in English. Otherwise, I don't speak in English at all. So my communication every day, wherever I go to supermarket or any place in Germany, it's going to be in German. It's not going to be in English. Second con is bureaucracy. Yeah, it takes a really long time to get things done here. I would say a simple example of a transaction, a bank transaction, which we do in India. We send so many lakhs and so many transfers. We do so much of transfers in India, which happens within a minute or seconds. Here, say for example, if I have to transfer today, Sunday night, if I have to transfer something, it won't get transferred today. It will get probably transferred tomorrow night. That's how it is. It will get deducted from my account, but it won't get. So that's the bureaucracy in terms of medical application. Also, it's going to be a long time. So when you send your documents to the State Medical Council, it's going to get a long time, minimum 6-7 months, for you to get a reply telling that they have received the documents. So such long processing times. So why? They say because of shortage of workers, but I'm not sure what is the true reason. We all the doctors who have come from different countries to Germany, everyone face the same thing. It's not about racism. Even the Germans do know that bureaucracy is a big problem in Germany, because they are not digitalized. Nothing here in Germany is digitalized. Now they're coming to the age of digitalization, of making the documents into digital version. They are taking everything. So if I have to open a bank account or something in India, we can do it everything online. Here I have to go to the bank, fix an appointment to go to the bank. Yeah, I just can't walk into the bank. That's one more thing. So I have to fix an appointment to go to the bank. So that's how it's going to be for each and everything. So if I have to send my documents, everything has to be sent through post, not through email. Each and every document applying for the exam will also be done through post. We apply for NEET exams and everything through online, very much. And we do know the difficulty of getting a center, how much struggle we face, the amount of people that we within a minute, it's like tatkal ticket being booked in India. But in Germany, it's more worse. We have to send the post, and it takes time for them to reply back to us telling that which date we have an exam. Yeah, so that's the thing. And work rules. Yeah, punctuality is a big thing here. They look into punctuality about a lot. In India, we have a lot of flexibility, irrespective of wherever we work, who is a professor or HOD. We have a lot of flexibility at times. But here in India, here in Germany, it's a different thing. Punctuality is a lot, will be seen very particularly. And during the work hours, phones are not allowed. Yeah, we are allowed to have our phones and everything, but when we use the phone, it's seen something as very, very, very rude and very impolite. So we are allowed to have the phones and everything in case of emergency. We are given a separate old Nokia kind of a mobile, which is only for the hospital. It's like a pager, like how they have it in US or UK. But here we are given an actual kind of old mobile, which does not have any internet connection, just to call the other doctors. So it's like they say duty mobile or something like that. So yeah, that's the thing. And there's massive documentation when you have to apply to Germany. And the last thing is also, yeah, so most of the salary which we get goes for taxes and insurances. I have to even insure my cycle. So that's how the things are there. There are insurance even for cycle, but it's really useful, which you will find out later when coming to Germany. So what are the types of hospitals, and what is the healthcare system here in Germany like? So when you're coming to Germany, and you want to know which hospital you have to apply to and everything, so there are many different types of hospitals. One is the uniclinics. So uniclinics are like the hospitals or the medical colleges in India where we have all studied. Yeah. So we have a medical college and we have a hospital attached to it. So that is what is medical college in India. Yeah. But here in Germany, that is called as uniclinics. Yeah. So they are one type of hospital. Yeah. The next is community hospital or municipal hospitals, they say. And this is where I work. Yeah. I work in a community / municipal hospital. Yeah. They are all affiliated to a uniclinic, to a university hospital. Yeah. And they do have residency programs and everything. Yeah. Every hospital here in Germany have residency program. So these municipality and community hospitals, why are they separate without any medical college attached to it? So that they have a distributed healthcare system throughout the country. It does not need much infrastructure. So in India, when we think of medical college, we think of, oh my God, so much of infrastructure, so much is needed, and so on. Here they don't want to do it like that, so that's why they have community municipality hospitals where they are distributed all over the country, and they all have residency programs, but not undergraduate programs. They all have residency programs for PGs. Yeah, uniclinics have undergraduate and postgraduate programs, but community hospitals and municipalities also have only PG programs. Yeah, private hospitals, there are some amount of private, very very few private hospitals in Germany. They are like Asclepios, Helios, Rhone, Zana. They are all like the like Apollo and Rela, and such kind of hospitals are called private hospitals. Like here, like Asclepios and Helios, they are such kind of hospitals here in Germany, which are all private hospitals. Where also the residency is free of cost, and it's the same. Yeah, the salaries differ a bit. I'll tell you about how it is. So what is the duration of time or duration of the residency program here in Germany for a surgical specialty? It's minimum of 5 years. So if you're going to do general surgery, you're going to do a general surgery for 4 to 5 years, 5 years actually. Yeah, it's a minimum of 5 years. So there's a logbook where every PG will have a logbook, just like how it's in India. We are here too. We have to maintain a logbook. So it's more like we have a set of procedures or surgeries which have to be completed. So even if 5 years are over and the logbook has some amount of cases which are still not completed, or some amount of surgeries which still are not completed, that means we cannot complete the surgical training. We need to go to another hospital and so on. And unlike India, where we stay in one hospital for 3 years, other than district rural postings, we stay in the same medical college for 3 years. Here in Germany, it's not like that. So in 5 years or 6 years, you can change 5 hospitals also, 5, 6 hospitals also. So that's up to you. So I'm in a hospital where they do so many endoprothetic surgeries, like hip replacement, knee replacement surgery. They do so much in this hospital, so many surgeries. Last year alone, they have done 1,400 endoprothetic surgeries, where that was 800 or 700 hip replacement and 600 knee replacement surgeries per day. They do 2 to 3 knee replacement and 3 hip surgeries. So that's the volume they do here. So when I feel that that is enough for me, and I want to go to a trauma surgical center where I want to do more, where there's more of trauma than endoprothetic, so I can go to another trauma center. So that's how it is here in Germany. You can keep shifting to hospitals based on vacancies. We'll have to apply to those hospitals wherever we find that the hospital is good and there is a vacancy also. We apply to those hospitals and we go on. So but it's a minimum of 5 years. So in 5 years, we have to try to complete the required number of procedures and surgeries and so on. And with super specialty, say for example, trauma surgery in India is considered super specialty. And if you take gastro surgery or you want to become a neurosurgeon, so that means you will be doing 1 or 2 years of 1 year of general surgery. You will have 6 months or 7 months of intensive medicine also. You'll have to do intensive medicine also, and you'll have to do 6 months of some other thing also. So there'll be 1 or 2 years will go on like that, just like how in India also we have such postings. And then you'll do neurosurgery for the rest of 3-4 years, and that's how it will be. And in this 3-4 years, you have to complete the number of surgeries that you have done. So in total, a minimum of 6 to 7 years. In total, a minimum again. So a minimum of 6 to 7 years. So when you're not completed so much of procedures, that means you have to complete it by going somewhere else, and then But mostly everyone complete within 5-6 years, unless and until people say, I need some more time to prepare for the exam and so on. Yeah. Medical specialty is the same thing, a minimum of 4 to 5 years in case of internal medicine or general medicine. Here, there's a difference between internal medicine and general medicine. So, in Germany, there is in their healthcare system, they have something called as Hausarzt. They are like family doctors. So every person, even myself, I'm registered by a family doctor here. Yeah, although he does not know anything about my family, but that's how it is called, like Hausarzt in it's called in German language. So, but in terms of English, I would say he is like a family physician or something like that. So, everyone has to be registered with a family physician. So, whenever I'm sick or something, I'll go to him, and then he will, in case if he's not going to be able to treat and requires a specialty treatment, then he will or write it to another specialty doctor. So that's how it will work. So all those who want to become Hausarzt or this family physician, they have to do general medicine, yeah, allgemein medicine, they say in German. And inner medicine is something for the people who want to do super specialty, like if they want to do gastroenterology, they want to do neurology, or they want to do anesthesia or something like that. It's different. So cardiology, they have to do inner medicine, so internal medicine, yeah. So it's slightly different when it comes to hospital, the terms of hospitals and the types of hospitals here in Germany. Yeah. So what are the salaries that we get here and everything? So there are two terms that I would like to say when if at all you're going to speak to some other German doctor to find about. So there's something called as brutto and netto. So what you see here on the right-hand side, this is the salary in the municipal or community hospitals, like the salary for it's like the same for almost all the hospitals here in Germany. Unlike India, where we say, yeah, this hospital pays me more, that hospital pays me less. Yeah, for PGs, it's almost the same. Yeah, but some hospitals pay a lot more better compared to other like central government hospitals. Whatever I've seen, PGs are paid better, I think, in India compared to other private hospitals or government hospitals. Yeah. But here in Germany, if you are part of any community or municipal hospital, which are like the 80% or 90% of the hospitals in Germany are community or municipal hospitals. Yeah, so this is going to be the salary. Yeah, so you can see that here, this is the salary till 31st of March, and this is going to be the salary which they're increasing because of inflation. Yeah, so every country is going to recession, and there is an inflation rate. So yeah, we got to know 6 to 7% is inflation in India. So Germany also has an inflation percent, and they want to also, like, the doctors have they have made a strike, and they said we need the salary to be increased. So this is the salary that they have been promised from 1st of April, which is going to be increased and so on. Yeah, so this is the table for the residence doctors, which I've highlighted here. This is called FACAs. FACAs are like after residency, you we become SRs in India. But in Germany, it's called Facharzt. Yeah, so we are called Facharzt here. And Oberarzt is like associate professors, and CA is actually Chefarzt, which are they are the HODs. Yeah. So this is what the table shows, the brutto, that is the salary before taxes. So, and after taxes with insurance deduction, pension insurance, nursing insurance, and so on, which will be somewhere around 35 to 42%. Actually, I'm sorry, that's 42%, not 40%. So 35 to 42% of the salary will be deducted before we get it in our account. And so at the end, we'll be getting somewhere between 3,000 to 3,400 euros per month in the account. Yeah. And this is only the base salary. When we do night duties, we are paid extra at around 40 euros per hour. So there are some hospitals who consider night duties as 24-hour duties. And there are some hospitals, 24 hours duties, meaning from 8 o'clock in the today to next day morning, 8 o'clock. And the next day will be off. Yeah, it's not like how in India where we work 36 hours. Here it's going to be like from 24 hours. Yeah, so 24 hours maximum. They have very strict labor laws here in Germany. Irrespective of whichever department or wherever we work, they have very strict labor laws where they say that this is the number of hours that they have to work per week. And when we cross that, the HR will call us telling that you have worked for so many hours. Either you have to take an off, or we have to do a compensation. Mostly they'll ask us to take an off. They'll say, so you have, they'll calculate that every 4 to 6 months, I think. So by the end of 6 months, and if they find that the number of hours that we have worked is actually exceeding, they will tell us to take an off. Yeah, for residency, for a PG, for a resident, I mean, for a PG doctor. Yeah, so night duties will be paid at 40 euros for extra per hour plus night duty allowance also. So this is not the actual salary. So you'll be getting somewhere around 4,000 or 4,000, more than 4,000 also sometimes. It depends upon when you do duties. So you're doing a duty on Saturday. That means you're working on a Saturday and a holiday also. That means you get extra like that. If you're doing a night duty on Monday to Tuesday, it's going to be something different. If you're doing a duty on Sunday, it's going to be different. If you're going to do a duty on national holidays, then you're going to be paid a little more extra, something like that. Yeah. So that is about the salary aspect of here. Yeah. Yeah, that is for the uni clinics, like the university hospitals. Yeah, every hospital you see, they will have almost the same salary with a plus or minus of 100 to 200. Yeah, so it's like 5,288 is close to yeah, and here you see it's 5,100 and so on. And next thing is that, say for example, you're already a PG in India and you're coming to Germany again, and you want to do a PG, or you want to do your further medical career here. Then when you have already done 3 years, so when you come to India, when you come to Germany, you start earning from the 4th year. That means your base salary will start from 5,900. That is after when you have shown your logbooks from India and all the post-graduation, everything that has to be submitted in here. When all this application process is done and all verified, and when the state medical council tells that, yeah, so you get into the 4th year, not the 4th, you get the 4th year of salary. So this is where you start. Yeah, so this is where so if you're not a PG, you have worked as a medical officer for 1 year or 2 years. That means, so if say you have worked for 2 years in India, so this is the you'll get into the salary bracket here, provided your medical officer, your work experience certificate is recognized here by the state medical council, and they've agreed to put you as a 3rd year. Yeah, but for the people who have not done PG in India, when you're coming to Germany and you want to start just want to start a PG here, you may start earning from the 3rd year, but your PG will start counted as 1st year. Yeah, for whereas the people who have done PG and are coming here, so you've already done 3 years of PG in India compared to the 5 years needed, or 5 or 6 years needed. They will see what are the deficiencies, or what are the how many more years you have to do, and what are the procedures that you need to do, and they'll calculate and tell, yeah, so you will need another 1 year to do, and so on. So that is for the people who have done PG or senior residents in India or doing PG right now. For all the people who have just completed MBBS and working as medical officers, when you come to Germany, you will be starting as a PGY1, that is your postgraduate residency year 1, but your experience from India will be taken, and if it's recognized, then you'll start earning from here from the 3rd year, but your PG will be from 1st year. So I hope you understand. Yeah, I have understood. Okay. So yeah, that is for the uni clinics or university hospitals. I also wanted to get into a university hospital directly when I came to Germany, and some of the seniors who were here, with whom I spoke to when I was coming to Germany, they told it's difficult to get into a university hospital, and it's not advisable to get directly into a university hospital because it's going to be difficult. I actually never took their advice, but I tried, and then I found out that it's really difficult to start working directly in a university hospital because everything is going to be in German, and the system here is going to be slightly different. Medicine things are going to be the same, whatever we give and everything, although they have few different medicines here. The drug of choice is slightly different here. But otherwise, yeah, because it's a developed country and they have a different type of disease here. So their drug of choices are different from what we have learned in India. That we'll get used to it in some amount of time. It's not going to be that difficult. So I would always suggest either start working in a municipality hospital or a community hospital or in a private hospital rather than directly going to university hospitals. It's better to go to university hospitals once you have got a sound grip of the German healthcare system and how to work in Germany, and then later you can go into university hospitals. Yeah, yeah. Okay. Yeah. So I've also forgotten to tell about Yeah, so the university hospitals, what are they? So they are like Charité, which most of them would have heard. It's also a university hospital. So Aachen or Heidelberg university hospitals, they are all of the university hospitals. So if at all I forgot to mention what are the university hospitals, what are the names. So they don't have any particular name. They have the name attached to the city wherever they are to. Yeah. So, okay. Yeah, so roadmap. What are the requirements that we do and need and everything? So first thing, to all the people who are still doing MBBS, doing CRR and everything, for all the people doing MBBS, I would say complete your final year and then start working towards your German language and so on. Don't start learning. There are a lot of people who spoke to me and they are doing final year or third year, and they said, I want to learn German language now. I would say go ahead, learn. But once you complete everything and then you don't have much time to do in MBBS itself, like you have a lot to learn and everything when you have a lot to do also. Once you even complete learning the language in by your third year or fourth year, by the time you complete CRRI and your documents are processed, and then when you come to Germany, you forget the language. When you forget the language, it's not going to be you can't think it's okay, I'll just take the books, I'll revise, and no, that's not how it's not going to work like that, because it's completely different. The language is completely different. The verb positions and the things which we use in English is completely different in German. So the verbs come at the end, they don't come in between. So it's a different language when you once you start learning. So I would say plan yourself from CRRI. That's when I actually started, and because of COVID, everything got messed up. But so I would say you can start from CRRI. And make sure that your degree, which you get from your medical college or whichever university it's affiliated to, you can check in this ANABIN website. Yeah. So this ANABIN website. You can type it in Google. You can just type ANABIN, and there'll be a website. You can take a screenshot of this PPT also, and I think it will also be posted on IMA JDN YouTube's channel also. You can check this later also again, but you can just check whether your college or your university is recognized by the German college. Most of the NMC recognized college in India are recognized by German Medical Council also. But although you can check once again, some of them, very, very few, exceptionally very few, are not recognized. You can just check your colleges, but most of the colleges are recognized. You don't have to worry about it. And when they are recognized, I'm sorry, I have no idea about it. You can just, I'll tell you about whom to ask and all those things. So whether you need a good CV, I would say your work experience matters a lot. When you want to plan immediately, so we Indians always have a plan of doing everything fast. So we want to complete a CRRI, and immediately after CRI, want to jump to PG. But in India, it's okay. But when you come to Germany, they'll see that you don't have work experience. Internship is not considered work experience. And when you complete only internship, when you don't have much of a clinical experience from India, and you want to come into a foreign country with a foreign language, and you want to work in a foreign healthcare system, it's going to be too much. It's going to be too much. You have to speak in German. You have to think so much when you're going to talk in German, because your mind will be very busy with thinking about how to bring the language out from your mouth. And also you have to think about what you have to treat with the patient and everything. So I would say, please work for a minimum of 1 to 2 years in India and then come to Germany, so that you have some amount of clinical experience, at least some amount of clinical experience. And then when you come to Germany, you will know. And I would say work in a hospital where you are able to do something clinically rather than only yeah, most of them, when they're preparing for USMLE or PLAB, they want to go to hospitals. We know that there are many hospitals that are not much of patient load. We just want to sit and study and have some amount of income. I would say try to go to a hospital where you are able to see patients, treat patients, or be a part of the team to see what's happening and how the patients are being treated, so that you know what's happening. And when you come to Germany, it's going to be a little easier, because we are expected directly to start with IV Venflons, with reanimation, CPR, and so on. Yeah, so it's better to have some amount of work experience, minimum of 1 to 2 years when you're in India. Please don't jump directly from CRI to Germany. It's not going to be easy. It's going to be a tough road, even to get PG positions or jobs also. Yeah. Research and volunteering, they're all extra. So they're all extra. When you do research and volunteering, it's all only extra. Main thing is the language and the work experience. When you have zero research papers, zero volunteering experience, it's okay. It's completely okay. It's not like going to be like USMLE, where even USMLE they only have 1 or 2 points, not much. But the language and the work experience is very important. So next, coming to finance. So when you're applying for the visa here in India for the German visa, you'll be applying firstly for the employment visa for the recognition of foreign professional qualifications. This is a particular visa which is called 16D, D for Delhi. 16D, D for Delhi, 16D visa. You can Google up in Google it's later also. You can just write 16D Germany, and then you will see there's a visa called employment visa, recognition of foreign professional qualifications. So that is the visa you'll be applying for, where you'll require blocked account, which is 1,033 euros currently, which is so you need to have 1,033 euros, which is close to 10,000 lakh, 10 lakhs, sorry, 10 lakhs in 10 lakh rupees. Yeah. So you need to transfer 10 lakh rupees to one of the block account issuing companies or service providers. You will have to transfer it to them, and then when you come to Germany and open a bank account here, they will start putting 1,033 euros per month in your German bank account. So that is for the initial expenses until you clear your licensing exam and so on. Okay, and then next is the language. So there are a total of 6 levels of language in Germany, starting from A1, A2, B1, B2, C1, C2. Once again, A1, A2, B1, B2, C1, C2. A minimum of B2 level of language certificate is needed when applying. A minimum of B1 or B2 language certificate is needed when you are applying for the visa. And the minimum of B2 level of certificate is required for the medical license exam here in Germany. Yeah. So you can take a quick screenshot of the documents which are going to be needed later. So the way you apply here for Germany, it's going to be like, you have to apply to particular state. You have to decide which state you're going to. And say, for example, there are so many states in Germany. So you need to decide which state you're going to. And there are so many statistics about it. There is so much to talk about it. I'm sorry, I won't be able to talk in this particular session about it. When needed, I'll talk about it later. Yeah. Yeah. So almost all state medical councils will require these certificates. Yeah. There'll be plus or minus for each state medical council. Yeah. In Germany, when you're applying to the residency or even for anything, you have to apply to state medical council. There is no particular for UK, you have general medical council. No, there's nothing like that for Germany. You have to apply to the particular state medical councils, whichever state you wish to go to. Yeah. And they will ask for these documents. So these documents you have to get it. So you see that there's going to be MBBS degree certificate. You need your internship completion certificate and so on. So all the MBBS students who are here thinking that you can start it right away, no, you don't. That's what I'm saying. Please wait. For Germany, we need a lot of patience. It's not that easy. Please don't jump into and think that, yeah, I'll start it right away. And please hold your horses down and complete your internship properly and then start your work. But you can start learning the language from internship. Yeah. So you need an internship completion certificate, state medical council registration certificate. There's a license certificate, yeah, from India, and good standing certificate from the state medical council, whichever state medical council you're registered at. And these two certificates, the passport police clearance certificate and the good standing certificate, are valid only for 3 months. So you need to time it properly so that it reaches German State Medical Council on time and not later than 3 months. Those all will be decided on a later date. I will be explained on a later date. If at all you all have doubts, you can approach your IMA JDN representatives, and probably if needed, they can organize another session for particular doubts on how to apply and everything, because application to Germany residence program is not so popular like how for USMLE and PLAB, where there are so many YouTube channels or so many people to guide to. For Germany, there are not much, and it's not particularly told also. Yeah, it's not that open also. So that can be later organized. Yeah, so make sure your passport name is the same in your birth certificate, in your MBBS or PG degree certificate, and your mark sheets and so on, and everywhere. I would also suggest to have your name, your expanded name. If you have any initials in your name, please expand them and have them the same in your passport, Aadhaar card, voter ID, whatever document, whatever ID you have in India, and also in all the certificates. If at all not, you can apply for them now before it's too late. You can apply for them now and make sure that it's all the same. Yeah. You can prepare all those documents and all. So make sure that all your name, it's the same. When you have your initial at the first or the end, I would say have the passport as the standard. And with that, make sure that you have all the others the same. Yeah. Like the first name and the last name should be the same in all the other certificates and documents, including your Aadhaar card. It's better you change it before you leave India. And then after you have all these documents, you need to attest it. So that means you have to send the documents to embassy. They will attest telling that the originals and the copies are the same. You have to send these copies to a translator who will translate all your certificates, including your passport copies. All the copies, I mean, not the original copies, original ones. I mean the Xerox copies, which are attested from the embassy, German embassy. They will have to be translated, and only after translation it has to be sent to German State Medical Council. Remember, I told about the cons of bureaucracy, the processing things and everything. So this is what it is about. So much of processing is there. It's the same again. Every country has its own difficulties. So in Germany, this is what the documentation, everything is difficult. But when you think about when I'm explaining right now, fast and everything, it may seem somewhat difficult and very complex, but it's not that complex. It can be easily done. Yeah. So so the process flow the process flow. So you will do till B2 in India. So I would say Goethe is the institute where you can learn the language. So you can just put this Goethe center in Google and you'll find so many. And there are many other institutes also where you can learn German language. Just make sure that the institute is good, where they teach good German and everything. And that Goethe, I find it slightly expensive. I've learned in Goethe. I have also learned in Language Pantheon, which is based in Delhi, but they have online institutes. I'm not advertising them here, but you can just find out. Yeah. So B2 Goethe, this certificate is needed. To get to this certificate, you can complete the language course in 6 months or 8 months also, from A1 to B2. Yeah. But I would say if you're working, if you're doing PG and then you want to learn the language side by side, it will take a minimum of 1 year. And this 1 year is not going to be that easy because you have tons of things to do in the hospital. And you also have to take the class. It is not going to be that easy, but that's how it's going to be. That's how I did it. And it requires a minimum of 1 year. If at all you've completed PG and you're at home and you don't want to work and then you want to do the language, you can complete it in 6 months also, but it's going to be very stressful. 6 months means you are going to do 6 hours. You're going to take 6 hours classes if you want to complete it fast, and 6 hours of German is too much. You'll understand that later when you start learning the language. So take your time, do it slowly. It's okay. And here in Germany, all the doctors, when they complete MBBS when they're at the age of 25 or 26. That's the time when they complete MBBS. So when we come here, we are seen upon very young doctors. Even though we have experience, they say, yeah, you're probably very young. I don't think so you have much experience. That's how they talk in interview. We need to prove that with our CVs and work experience certificate, and that we have experience and so on. Yeah, so yeah. And then you will have to apply for this deficit Bescheid, which is actually the evaluation. Now you send all the documents after attestation and translation. So all these documents which I showed in the previous slide, you get them attested from the embassies, German embassies in India. You get it translated by a German translator, and then you send it to the medical council. They will take some months, minimum of 4, 5 months or 6 months to send the the evaluation certificate, which is called this deficit Bescheid. Yeah, this is deficit Bescheid. So this entire process, yeah, when you start learning the language, you can apply for the deficit Bescheid, and everything will take around 12 to 14 months. And after you get the deficit Bescheid, then you apply for the visa. This is the 16B visa, which I was talking about in the second point. So the application of visa and then getting the visa. Once you apply for the visa, once you go for the interview, it will take a minimum of 2 to 3 months, minimum of 2 to 3 months for them to approve the visa or give a response. Yeah. And after that, once you come to Germany, you will be doing the C1 special course for doctors in Germany, which is a training for this Fachsprachprüfung. So there are two exams which you'll be giving here in Germany. One is the Fachsprachprüfung, which is a temporary medical license exam, which is valid for 2 years, and where you can work only in one state. So you will be doing a course called the C1 special course for German doctors, where you will be learning specific all the terminologies, medical terminology, whatever we learned in MBBS, like, all, say, for example, bone and everything, bones, whatever the bones in the body. For rib cage, we don't say rib cage here, they have to say Brustkorb, so it's different. So all those things will be learned in this course, will be taught in this course, and we'll have to learn this one, and it'll be done in this exam. And then you'll be doing the KP exam. You'll after that, after clearing this FSP exam, you will get a temporary license with which you can start working, but the PG does not start yet. You can only start working and start earning the salary which I showed in the previous slides, but your PG does not start yet. Your PG starts after completing this KP. So this KP is called Kenntnisprüfung, yeah, which is a Kenntnisprüfung and the permanent medical license exam. And once you clear that exam, then you can start your residency. You can just convert the job where you're working as your residency, and whatever you start, whatever surgeries you do starts getting counted. Say, for example, you're working in a hospital after this FSP exam, and you're doing, like, say, for example, you're in my example. So I'm working in a trauma surgery and so on. I'm doing surgeries right now. I'm getting paid the same salary, but my surgeries which I'm doing are not getting registered in my logbook. It will get registered only after I finish this KP exam. And after that, every surgery I get, it will be written in the logbook. And then later, after that, but the salary will be the same. So the salary will be the same, mostly the same. When you finish the FSP exam and you earn, and the KP exam you earn, it's going to be the same. Yeah. So what are the exams that you'll have to give? First is the language exam. Yeah, this is what I spoke about. A1, A2, B1, B2. Yeah, B1 is split into B2.1 and B2.2, but yeah, that's how it is. So you will be learning till B2 in India, and then you come to Germany, and then you'll do the FSP exam, and then the KP exam. Yeah, so FSP exam is basically only history taking without examination. So you'll be given a actor. You will take the history of the patient in German language, and then there'll be 20 minutes to take the history, 20 minutes to write the case sheet. Case sheet also has to be written in German, and then 20 minutes for the viva. Yeah, the viva will also be in German. Yeah, so this is FSP. KP, it's different. So KP will be everything. It's going to be the same thing. The cases and everything is almost the same thing, like how we have learned in MBBS and all. So you'll have the same kind of cases like hernia or cholecystitis or cholelithiasis, or cardiology like cardiac failure, or respiratory disease like COPD and so on. So similar kind of cases you'll be having in both the exams. Yeah. But here you won't examine the patient. It's only going to test on the language, how far you know the language and how far and so on. And with the history, how are you able to get diagnosis and investigations, whatever you suggest with the history, that will be tested here in FSP. In KP, it's going to be just like the MBBS exam, but a little more of higher standards about into depth into the examination and treatment and investigation. So coming to the expenses about what you'll need before starting as a doctor, when you're here as a student learning the language. So this is the monthly expenses you'll be taking 1,033 euros monthly into the blocked accounts, which is going to be somewhere around for 12,000 euros. Yeah, it's going to be 12,000 euros for 1 year. So that's the visa requirement. And every month you get this 1,033 euros into the German bank account, and out of which, yeah, fine, will go for rent, transportation, yeah, 100 euros or less also. So this is mostly, this is like a range. It can be lesser, it can be less or more also. Yeah. So I'm just giving a rough estimate, but this 1,033 euros, it has to be a must. 1,033 euros per month for 1 year. Yeah. So it's close to 10 to 12 lakhs. Yeah, rupees you will have to secure right now or before you're applying for visa. And yeah, once you clear their first FSP exam, you will be paid a minimum of 2,000 euros once you start working after the FSP exam. So you get paid a minimum of 2,000 euros brutto, that is not the netto, brutto, meaning after taxes and everything, you get a minimum of 2,000. You get somewhere 2,500. If the hospitals are good and everything, they pay the entire amount also, like whatever I showed in the previous slides. So you get paid the entire amount. Very few hospitals don't pay them because you don't have the full license. You only have a temporary license. So they pay only a half amount, but 80% of the hospitals, they pay the full amount. Okay, so that is a rough wrap up about whatever I've told. You can think about whatever questions you have and everything. So before I came to Germany, I had a lot of expressions like, yeah, it is going to be chill. I'll be able to chill. I'll be going around. I'll be having a Schengen visa. So I'll be able to travel to Switzerland. I'll go to Netherlands. I'll go to Sweden and all those things. But reality is somewhat completely something else, so once you come here, you are going to be on your own. You have to take care of yourself, and it's going to be all alone. So it's going to be in a completely different country without any of your friends, family, or support. And luckily I came with my junior also, from my same university, so we knew each other for a long time, and we both planned together, and we came, and it was quite somewhat easy for both of us and so on. Yeah, so we both have actually made a video for you all to just show what were the expectations when we came, and like what was the reality later that we had to take care of into. And the video may be, for the people who are not from Tamil Nadu, at the end you may find that what are they even talking about, what do you mean. So but it's just a video for for fun purposes, nothing much. And yeah, so people from Tamil Nadu, it's a clip from a movie, so only the people from Tamil Nadu can understand it actually. So just a small AV. Yeah, I hope you were able to hear the audio also.
எதுக்கு வந்தோன்றதையே மறந்துட்டு நஜ சமையல்காரனாவே மாறிட்டானே.
ஏன் பாஸ் டல்லா இருக்கீங்க?
மூஞ்சிக்கு பவுடர் அடிக்கிறேன். டேய்
So yeah, that was a short clip about from me and how we did it. And so that's almost for the same for all the countries, for all the expats or like the people whom we are migrating from one country to another in search of job opportunities, residence and everything. It's going to be the same situation for all. And I would say there are two important websites where you can get so much of info, not just for doctors, for all the other professions also, which is Make It in Germany and Anerkennung in Deutschland. So these two websites are like really good websites. They're official German of government websites. Like they are from the German government, and they are really good. And there is one more service provider chamber from Germany, which is called Pro Recognition. Pro Recognition, Pro PRO and Recognition. Yeah, so you can search this in. They are in Pune. Yeah, they are based in Pune. They are official chamber of commerce from Germany. So they help all people, like irrespective of whether you're doctor, engineer, or any other profession. They help in about the guiding. They help in the application process about what are the documents required and so on and all. You can contact them also. They're not. They're like a consultancy service, but free of cost from the German government. It's called Pro Recognition. PRO Pro Recognition -Recognition. You can search in Google also. But Make It in German Anerkennung. You can find Pro Recognition also being suggested in these two websites. Please go through makeitingermany.com and Anerkennung in Deutschland. They are like really good websites. You can switch to English on the top. You can find that mostly these websites will be in German, but you can switch to English also. You can look into the website top corner. It'll be in. You can find the language in English also. So yeah, this was almost entire of my video, my presentation also. Yeah, and yeah, thank you all. So these are two quotes that I would suggest to all of them. It's not that it's very tough. I might have explained too much. It might have been too much for the first time, but it's a good journey, to be very honest about. And when you learn the language, you feel that you are capable of even learning a language. And that's how it is, because even I was not confident when I started Germany. And particularly as soon as I started, COVID came, I almost thought I would not be going to Germany. I have to just think about NEET and some other platforms. And yeah, but later I found the courage again and I took the first step. Yeah, so I took it in faith and I just started going ahead. I don't know how it's going to go. And many people even have the questions of whether the degree which we do in Germany is recognized in India or not. Previously, I have learned it in Schedule 2 of MCI. Yeah, MCI is not there anymore, but it's now NMC. They had previously recognized few universities and so on. We have to see what is the update from NMC later. Yeah, so I think someone also gave an RTI to NMC recently regarding the recognition of German courses or German residency in India, and they have some amount of recognition. And probably in the future, one of my professor also told, who knows, in the future mostly India will recognize other professional things also, while because India will also later have a lot of shortages in doctors, just like how Germany is having right now, because Indian population is growing voluminous and we will need a lot of doctors. We do need doctors now also and later also. Yeah, so they will start recognizing other country PG degrees also. So yeah. So coming to questions now, I'll stop sharing now.
Hello, Dr. Yogesh.
Hello, Dr. Pavan.
Guys, so I'm Dr. Pavan, CRI from Ramaswamy Medical College and part of IMA MSN. I just kindly request all the participants over here, kindly put your doubts or any queries in the question box so that we will address all your queries. We are open up to all your queries. First, so a few things I've been noticing in this chat box. I'll just tell a few questions. Is there any age limit is there for the PG to study in Germany? Yeah.
There is no age limit at all. Here in Germany, anyone can start at any point of time, any age at all. So even if you're 35 years old, you can start. I have seen so many doctors here who are old as 35 and they're just first year PGs here. They have earlier worked as truck drivers. They did MBBS, and for some reasons they worked into some other department, some other field, and then they came back to medicine. And there's no age limit.
Okay, thank you, sir. Sir, also they ask mainly about the German language. Like, where did you study, like app or something?
Yeah. So no, I would not suggest studying from apps like Duolingo and all those things. So I would say it's better to go to particular good language institutes. I have no experience from studying from apps, but I have only used them as a helping tool. So when I've completed my classes and when I'm on traveling somewhere or I'm going somewhere or I'm sitting somewhere and having some time, I'll just go through these apps, or I go through Instagram pages for German learning and all, and where we can learn a lot of other things. But to clear the exam, to write the exam, language certificate, German language certificate exam, it's better to go to a good institute and learn properly. Because when you come here, everything is going to be in German. There's not going to be any document that you receive, any letter that we receive, everything is going to be in German. It's not like many will think like, yeah, but definitely it's going to be English. No, it's not like that. Here, everything is going to be in German. So German is very, 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 very important. Even if you have no experience, it's okay. German is very important.
So, like any institute there in India, you're telling about in Germany, language institute?
So Goethe Institute, which I said is the official. There are two official language institutes which are recognized by German government. One is called Goethe, the other is TELC. So Goethe is Goethe. Yeah. So Goethe and so I'm texting. Or is that okay? So Goethe and TELC. Yeah. So these are the two institutes which are recognized by the German government in all over the world. Goethe is available in India. I think TELC also, they have recently started only doing the exams. They're providing exams, I think, right now in India. But Goethe has both language courses and also exams. And there are other institutes also. I learned in I learned in Goethe initially, and then also learned in Language Pantheon. They are in Delhi. This is not I'm not marketing them. I'm just telling where I have learned.
It actually they're like little confused.
There are many other institutes also. There are many private tutors also who have come away from Goethe and they're teaching privately also. So yeah.
So my next question from the participants is if you complete a PG in India and then you wanted to work in Germany, what can we do?
So we'll, as I told, the documents required, I've shown the slide. So we need to get ready of all these documents, prepare all these documents, get them attested and translated, and then we have to send it to the particular state. So we need to choose which state we are going to in Germany. And it's a lot of things have to be considered when we are deciding which state we are going to. So that we'll be talking about later. I don't want to go into depth because there are some states in the eastern side where it's a little difficult and they already have a lot of doctors or they already have a lot of applicants, because of which the processing time is slow and so on. So they need to prepare these documents, get them attested, translated, and then send it to the state medical council. The state medical council will look into the documents and say whether they have sufficient number of surgeries done and all those things. When no, they'll mostly say you have to do one more year of residency here in Germany. So they'll have to do minimum 1 or 2 years of residency again here in Germany. They will be paid according to what I've told. I've told the salary. So they'll be paid according to 4th year of salary slab, not the 1st year of salary slab. So they'll be paid according to 4th year of salary slab, and their knowledge from India, generally, like the doctors here in Germany, they do have a good amount of respect for the doctors coming from India, because we tend to have seen a lot of cases. Although we are young, we have seen a lot of cases because of the amount of caseload that we see in India. So they tend to have good. So when you have completed PG, they do respect a lot. Yeah. So they say, okay, good, but they see what is our competency and everything. Because exactly. So we do know that some colleges or some other colleges where we have learned, probably because of COVID or some reasons, we didn't have much of caseload or something. And when you come here, although we say we are PG, we were not able to bring them out. They will teach. They'll surely definitely teach. They'll teach and they'll say everything. Yeah. So they'll have to
you need to like after the residency, like you need to have like any exams to take there so that we can like completely work in Germany. Is there
so
the same exams?
First, just like how USMLE and PLAB, we have two exams here. One is the FSP exam and KP exam. Yeah.
Okay.
So FSP is the Fachsprachprüfung, where we'll be tested only about the medical terminologies in German language. And the KP exam is the Kenntnisprüfung, where the entire medical knowledge in German will be tested. Yeah. So everything will be tested in German. Yeah. So after this thing, you will start the residency. And after the residency, we'll be giving something called as Facharztprüfung. So Prüfung is actually exam. So Facharztprüfung meaning the specialty exam. That's like for the residency which you have done. Say, for example, you're a gastrosurgeon and you want to you're completing the residency program. At the end of 6 years, you will give the exam. Just like how we do it in India. At the end of 3 years of PG, we give an exam and we get the PG degree. Just like that in Germany also is the same thing. So even if a doctor who has completed PG in India, when they come to Germany, they have to write these exams again, clear that, and then they will get the specialty degree from Germany. And then they'll be considered as Facharzt and they'll be paid according to the Facharzt, and they'll be, they'll start doing surgeries according to the Facharzt level of competency.
Okay. Then next question is, can you work in EU post doing residency in Germany?
What do you mean EU post? I'm sorry, I don't get it.
I'm also not getting it.
Okay, so in EU, post residency in Germany. So in European countries, other Europe. So that I think it's like every country needs medical licensing exam. So getting a residency from Germany does not mean it's easy to go and work in Switzerland or Netherlands or Belgium. No, they have their own medical councils. So that means we have to write their medical council exams to get their medical license. So it's the same thing. So because it's okay, for a clear example, when we have studied in Tamil Nadu and we want to do PG in some other state, we have to transfer a license from Tamil Nadu Medical Council to another medical council. So when we are doing it from state to state, I think we have to do it from country to country, even if if they belong to the same European Union. This European Union is actually for trade and not for doctors. So European Union is mainly so made for trade, to ease the trade. That is why the Schengen countries are all together, and just because of trade. And for business reasons. For doctors, we don't have any advantage because of that. We only have the advantage of traveling without any visa requirements or any special, we can just go on like that with our German visa. But to work as a doctor in other EU country, you need to take up their country's licensing exam.
Okay. Then can you compare MRCS pathway and German pathway after PG in India? Yeah.
Okay, so MRCS pathway. So I have seen many German doctors also do MRCS also later. But what I have heard is that when you complete the residency in Germany, particularly say for MRCS is like for surgeons. So when you do that, you automatically get either MRCS or FRCS. That's what I have heard. So when you apply for MRCS or FRCS, you can just tell that you completed a residency program in Germany, and there is some other process there. I have heard something about it, and we do have some separate, advantages of doing residency program in Germany. We don't have to go through the entire process of MRCS or FRCS for that. For FRCS is different. MRCS, we don't have to go through the entire process. We automatically get the MRCS, I think.
Okay.
FRCS, we have to do. It's a different thing. We have to apply and have to go through that. Yeah.
If you complete your PG in Germany, like when you come back to India, you can start practicing directly, or any exams here, clearance there?
So we already have our medical license in India. Yeah. So when we come back to India, we can definitely start working.
Okay.
But whether we can work in government setup is whether we can work in a government setup is a question. Yeah. So mostly we can work in private setups like private hospitals like Apollo or Ella and all those hospitals. But to work in a government setup, I'm not sure. To work in a medical college, so there are many medical colleges. Like say for example, our university where we have studied, we have a private setup and a medical college setup. So we can work as consultants, but not as professors. So that's probably another disadvantage because until our degrees are recognized, we won't be able to work as professors, but we can work definitely as consultants. Like so, we can get into assistant consultant, associate consultant, and senior consultant, and so on. But as professors, I don't think so. We'll be able to get into professors unless NMC recognizes the other state medical council from Germany. Yeah.
Like one candidate wanted to know, like they wanted to pursue dermatology. Is it like very tough, or they require any experience in the dermatology field as such?
Yeah. So here, dermatology. I have one of my friends also asked about it. I looked into it. So the number of vacancies for dermatology is always less. Whatever I have noticed. So, but they can try, but it's been less. The need for dermatologists have been less here, but they can try.
Okay.
They can try allgemein medicine, that is like general medicine first, and then they can slowly start working towards allergy medicine. Yeah, where mostly the allergy medicine doctors, they take care of dermatology also here. In India, it's the other way around. The dermatologists take care of the allergy, but here it's like the allergy doctors also look into dermatology also. So
yeah. So any other question, guys? It's like we can wind the session if no other further questions, and then you can even contact Dr. Yogesh in person. Also, it's like, would you like to share your email so if they have any future queries, they can.
Yeah, we can do that. I actually got a suggestion from the team organizing committee telling that if at all needed, we can organize for all the people who want a separate session particularly about the application process and everything. Because this is just superficial. Although I've spoken too much, but the superficial pathway, superficial guidance to what is about Germany and everything. For application, particularly to how to apply, what are the steps in application process and everything, we can have probably a separate session again. You can contact the IMA, but I can leave my email address here also, which is not a problem.
So yeah, the video will be posted in couple of days in YouTube. So if you guys like missed few parts, you can watch out there in IMA JDN YouTube channel.
Yeah, you can also find me on LinkedIn and Instagram also. I think there are some amount of questions here. Sorry. So, okay, I will also go through the questions. If at all someone finds that their questions have been missed out, you can either raise your hand and you can ask the questions. Are there anyone raising their hands? And so no hands are raised. Okay. So I think we can wind up the session if at all. So someone has asked scope for anesthesiology. Yeah, anesthesia, there are a lot of scopes. Yeah, so they do, anesthesia is good here. Yeah, what I've seen, the way they wake up the patients, really good. Like one of my friend or my junior also had a surgery and they say anesthesia, the way they do it, and he has had surgeries in India and also here. I'm not degrading our anesthetist. I'm sorry, but our anesthetists have a very good experience. But here, the way they do it and the way they use they have a separate room in the theater for anesthesia. So they put the patient there to sleep, and then they move the patient to the table, to the theater table. So
like a pre-op holding area.
No. It's pre-op holding area. We do have a pre-op holding area here, but I mean in the theater hall, we have a separate small room only for intubation and to put the patient into anesthesia. And from there, they shifted. I've asked, why do you have a separate room? It takes so much of time. Then later shifting here and so on. When you have the patient here, we can start positioning the patient and all those things. Yeah, it saves time. They said, no, it's to decrease the patient anxiety and all those things. And when something is a difficult airway, we have all the required cupboards and everything here. It's easy for them. Yeah, they had their own reasons to tell about. So yeah, but anesthesia is good. Anesthesia is good. You can try anesthesia. There are a lot of vacancies for anesthesia also. Is there any transfer program to continue medical education in Germany while doing MBBS? I'm sorry, I have no idea about this thing. It's not, you can't just transfer, because German language is required even for doing MBBS. It's unlike a lot of other our colleagues who have gone to China or Russia or Ukraine or Philippines to do MBBS, where they have done it in English. In Germany, it's going to be in German. It's not going to. You don't have any English taught MBBS programs. No, not at all. It's completely in German. Please don't talk to your engineering friends who say that, yeah, I have English taught programs, English taught master's programs or undergraduate programs in Germany. I'm going to apply for them. No, it's a different story for them. We are doctors. Wherever we go, it's not going. Our life is not going to be easy. Yeah, that's what I have seen from talking to all other people. Doctors' lives are never easy in any other in the world. So yeah, unfortunately. Okay. M. Viveka. So what about FMG students who have cleared MCA exam cleared and RMC also have to same procedure? Yes. Yeah. So FMG students who have completed their MBBS in China, Ukraine, Russia, and so on, you will need the same documents which I mentioned. You need to collect all the documents from your college in whichever country you have done it. You will be registered, in one particular state council in India. From this state medical council, you need a good standing certificate and so on. And there you have to get all these documents, get them attested, translated, and then send to the state medical council. Yeah, it's almost the same procedure for FMG students. It may take some more extra time because you've done it in 2 countries, and some of your documents might also be in other language. For example, I've seen some of the people who have done it in Ukraine or something. They have their language, their certificates are in Ukraine language. It was not in English, so they had to find a translator who can translate from Ukraine to English or Ukraine to directly to German and so on. It was quite tough for them. Okay, how's the caseload on everyday basis in Germany? Yeah, it depends on particular hospitals wherever you are. So it's not, so the place where I work or the city where I am, it's called Brakel. It's a very small city, to be honest. It's like a tier 2, tier 3 city. I would say tier 3 city, like very small city, to be very honest. But the amount of cases, they come, like people here in Germany, they travel to the best hospitals rather than going to the nearest hospital, like how it's in India. Because Germany is not a big country like India. It's like, the size of the German country is small. It's only like half of India, I would say. And it's very well connected to highways and all these things. So you can travel to in 200 kilometers. If you want to go to a destination 200 kilometers away, you can reach there in 1.5 hours or 1 hour. In India, it's totally different. Yeah. So you need to look at the hospitals where you're applying to. Let's now summarize a bit from the beginning. Mukesh, I'm sorry. I have told a lot. You'll probably get the YouTube video later. So please look into the YouTube video. Irene, which are the countries in which the German degree is recognized for practice? I heard the Gulf countries like Dubai and all those things, they are okay with it. Even UK is okay with it, but we need to write the PLAB. Once you clear PLAB, your degree is recognized. You go into the consultant. Also, you will start working as a consultant, and but you have to clear the PLAB again. It's the same for USMLE also. You clear the USMLE, you clear PLAB, and then you submit your German residency course. Then you're considered as a consultant and all those things. That's what I have heard so far. Yeah. Okay. Is it hard to pursue the career as a dermatologist in Germany? Yeah, I've already mentioned. Do they require a year of experience as an assistant or another field like internal medicine or internal surgery? Dermatologists require, definitely you will need to work a year or a half in internal medicine or general medicine, definitely in Germany. And in India also, they will look into your PG logbook and they will decide and tell you what all has to be done. Vidya Abe, can you compare MRCS with that we have already spoken? Can you work near you? That also we worked about, spoken about. Is it necessary to register to Institute? So, okay. So new messages. Germany with a dependent visa from my husband is the procedure the same. Dr. Jyotsna Ganesan, you're already living with a dependent. Yeah, the procedure is the same, but you need to, the documents and everything. Your police clearance certificate has to be from Germany and not from India. So slight differences are there, but the documents required is almost the same. Your good standing certificate, you have to apply from your state medical council, whichever you're registered in India only. But police clearance certificate will have to be from Germany because I think you would have lived for more than a couple of months in Germany. Where do you think is better to work in TN for working so that it's recognized in Germany? I'm sorry, that I can't. You have to think about which hospital. So when I tell this hospital is good, that hospital is good, that obviously I'm biased or I'm telling something wrong. So the hospitals where it. I don't particularly have to say. Scope for radiology. Radiology is also good, but not many positions available. But radiology is also good, but the amount of positions available for radiology is quite less. Okay, so that's almost. I think I've cleared all the doubts. Yeah, so I think you can wind up. If anyone have any particular doubts or anything, please do write on the chat message or please raise your hand. Yeah. Okay, that's all. So I thank all the organizers for giving me this opportunity. I hope I've done the justice for the opportunity by giving a lot of info, and I think I've also bombarded with a lot of information. But coming to a place, to a country where it's with a different language, wherever you try to find information, it's going to be difficult because the information which you find is also going to be in German. So that means you'll have to translate the information once again. So you'll have to, yeah, I did rely on completely to seniors. I kept talking to a lot of people so whomever I met, I said I'm going to Germany. Yeah, there's a this superstition in India telling that when you keep telling people that you're doing this thing, doing that thing, it will never happen. Please don't do that. Please keep talking to people, keep connecting to people, find who are the other people who are also going to Germany. Try to plan with them, learn with them, apply with them, so that you have someone, and it's quite easy to do that way. Connect to seniors, find out who have gone to Germany, talk to them also. You got an opinion from me, find out from them what is their opinion also, and what all the steps which I've said is the same, but the feedback and everything you need to talk to other people also and find out, because living in Germany with a lot of rules, so many rules are here when living in Germany. When it comes to garbage separation, from times about when you can party and all. So there's so many things about to talk about all those things. You can look into that in YouTube also. Yeah. So I thank once again the organizers for their time, and it's almost time for you all also to go to bed, so that because tomorrow it's Monday. Yeah. Yeah. So we have to start on the next week. Thank you all.
Ronan, you're muted. Saravanan, unmute.
Sorry, thank you. So thank you for the wonderful session. Dr. Yogesh, thank you so much for spending your time. And it was so wonderful to be with you. And I also seen your path personally, like past 3-4 years, I've watching you, what you've been doing in Ramachandran, how like intensely you're preparing for your German language. I would withstand all the thing with you. So if more doubts or any queries, you can ask Dr. Yogesh by his email, and then we'll be posting this full session video in YouTube channel. So anything else, Dr. Ariyaran, you want to tell something?
It was a wonderful session. I think it was enlightening. I think we'll go over to Venkatesh or Nanjavardhan for the vote of thanks.
Okay. Thank you.
Am I audible, sir?
Yeah. Yes.
Yeah. Good evening, one and all. This is Dr. Nijavardhan, General Secretary of IMA JDN, Tamil Nadu. I stand before you with a heart full of gratitude as we bring to a close on this enlightened webinar on guidance to young doctors for a career in Germany. First and foremost, I would like to extend our deepest appreciation to our distinguished presenter, Dr. R.J. Yogesh Kumar, sir. Your insights, expertise, and valuable perspectives have been the cornerstone of today's discussion, sir. Your willingness to share your knowledge has undoubtedly provided invaluable guidance to our young doctors embarking on their career journeys. To all the participants who actively engaged in the discussions, asked thoughtful questions, Thank you. Your enthusiasm and commitment to the learning are the driving forces behind the success of this webinar. I would also like to express my heartfelt gratitude to IMA Tamil Nadu State Branch, State President, our mentor, Dr. K.M. Abul Hasan Sir, Honorable State Secretary, Dr. S. Karthik Prabhu Sir, Honorable State Finance Secretary, Dr. S. Gauri Shankar Sir, IMA JDN National Convener, Dr. Indranil Deshmukh, IMA JDN Tamil Nadu Chairman, Dr. B.S. Hariharan Sir, Vice Chairman, Dr. Thiruvenkata Lakshmanan Sir, and our convener, Dr. Venkatesh Karthikeyan, Job Opportunities in Charge and Coordinator of this webinar, Dr. Rishabh Verma. In conclusion, let us carry forward the knowledge gained today and use it as a compass in navigating the path to a successful medical career in journey. Once again, thank you to our chief guest, presenter, participants, and everyone involved. Your presence has made this webinar an enlightening and memorable experience. We look forward to future collaborations and wish everyone continued success in their professional endeavors. Thank you. Thank you so much, sir.
Thank you, Dr. Yogesh. Thank you, Rishabh.
Thank you all. And thank you, Rishabh.